Hi, I'm Dr. Nick Crosby of the Indiana Hand to Shoulder Center. I look forward to getting to know you and helping you with your hand or upper extremity condition. I was born and raised in Utah, the youngest of 4 boys. After graduating high school, I spent 2 years of church service missionary work, after which I went to the University of Utah for my undergraduate degree. While at the University of Utah, I was educated with the Honors at Entrance full tuition scholarship and earned a degree in a Bachelor's of Science in Exercise and Sports Science. After graduating from the University of Utah with my Bachelor's in Science, my wife and I traveled to North Carolina, where I completed my medical school degree at the Wake Forest University School of Medicine. 5 years were spent in orthopedic specialty training. Following that, I had the privilege of coming to Indianapolis to the Indiana Hand to Shoulder Center, where I trained for 1 more year with a focus in subspecialty and hand and upper extremity training. Following my year of training at the Indiana Hand to Shoulder Center, the staff surgeons invited me to join the group, where I've been practicing since finishing my fellowship training. My practice focuses on conditions of the hand and wrist. In addition to that, I have a specialty focus on shoulder, wrist, and elbow arthroscopy, as well as reconstruction and replacement of the shoulder and the elbow. In addition to my clinical practice, I take great pride in the education I'm allowed to provide. I serve as a full-time clinical instructor for the Indiana University Orthopedic Department and train a third-year resident while working with patients. In addition to the resident training, I work with 7 hand fellows training at our facility with the other physicians currently. The most important part of my clinical practice is communicating well with patients. I feel it's very important to discuss with them the condition that they have, as well as treatment options, and allow the patient the opportunity to decide how they'd like to proceed. In many cases, it's a non-operative care. We work carefully with the therapist to help rehabilitate patients. In other instances, this requires surgical intervention. In addition to my clinical practice here in Indianapolis, I feel it's very important to share the knowledge that we have with those around the world. I've had the opportunity to participate in medical mission trips abroad. Recently, I was able to visit Nicaragua and share some of our surgical techniques with the staff and orthopedic residents there to help them understand the hand surgery art form. Outside of work, I enjoy spending time with my wife and 4 children. My personal hobbies include running, golf, any sports activities, and outdoor activities including fly fishing and hunting. One thing I believe is important is being able to reach out to as many patients in the region as possible. For that reason, I see patients at 3 different locations. Thank you for taking time to view this video. I look forward to meeting you and talking to you about your hand or upper extremity condition. To find out more about how you can visit with me and discuss your condition, please visit indianahandtoshoulder.com or call 1-800-888-HAND.